So,
right, James, we are obviously still in the middle of what we're trying to call a lockdown here in Scotland, but a nation in other side of the world managing to make their way out of that is New Zealand, and we're happy to be joined by Arindam Basu to talk about New Zealand's response to COVID-19. Arindam, could you sort of explain a bit about yourself and what it is you do?
yes, my name is Arindam Basu. Hello and welcome. I am an associate professor of epidemiology and environmental health at the University of Canterbury in Christchurch in New Zealand. So that's what I do.
Yeah, it's but obviously epidemiology is obviously, it's been perhaps not well spoken about by some in the general public over the last many years, but certainly in the last few months and perhaps last 6 months, maybe it certainly came to the public's eye.
Yes, that is correct. I mean, certainly epidemiologists have been working behind the scenes for now centuries, and both Scotland and the UK have produced some of the world's best and epoch-making epidemiologists in the world. For example, people like John Grant and John Snow, they've been legends. But yes, rather now you get to see that they come to the fore because of this unusual epidemic, pandemic.
Yeah, we're just going to obviously speak a wee bit about that today. Very, very odd this actually. I feel a bit weird because it's morning where you are and it's like bedtime for me here. It's all very odd timing wise, isn't it?
Technology, Ben, technology.
That's the thing. I think obviously things like this, I mean, who'd have thought it'd have been possible? It's so easy this as well, you know what I mean? To speak to someone on the other side of the world, just in the country, to be able to share information so easily is a handy. Right. Yeah. New Zealand's initial response to COVID-19, when sort of was the first cases in your country?
Yes, the first cases came around the end of February. But what happened was that, as you know, New Zealand is a country of 5 million people. It is a small country. It is completely surrounded by the ocean, the Pacific Ocean. And we are a quite small but quite tightly knit country. There are 2 islands separated by a tract of water, the Tasman Sea. There's a in between the 2 islands. There is there is no real bridge or anything like that. You have to go by using a ferry. But what happened was that in the last week of February we had the first case, and then the number of cases started increasing because all of our initial cases, and pretty much most of our cases, have been imported cases. So people were traveling from China, arrived in New Zealand. People were in Europe, they came to New Zealand, and this is our winter season, which means that this is a main tourist season. A lot of people, I mean, February, March, when that happened, was our kind of end of summer, beginning of autumn season. And so that is a very popular time when people come and travel here. And so we had several tourists who were in the country. There were people who were arriving at the end of the year. So there was a good opportunity of an infection taking hold in the country. And be that as it may, we started with very few cases in the beginning of March. But by the time we went into the middle to the 3rd week of March, we realized that there was hint of community transmission. And by then, the government had established a committee that was modeling the spread of the disease. In other words, they were using computational methods to predict and project what the numbers might be. So around say 18th and 19th of March, it was apparent that by then, if nothing drastic was done, by drastic I mean if we only depended on social distancing and hand hygiene and respiratory hygiene, but did not lock down the country for an extended period, then that might lead to an escalation of the problem that we might not be able to manage, because our intensive care capacity were low. And at that point, the government was not really looking only at what is referred to as flattening the curve, in other words, reducing the rate of the rise of infection, but rather they wanted to go for entirely, quote unquote, quashing the epidemic. In other words, reduce the number of new and existent cases to such a level that infection cannot come back. So accordingly, the government set up a 4-tier level of action plan. So they said that level 1 would be where people are kind of free to go about and hang out and continue their duties as or their business as usual. But with level 4, which was the highest and the most secure level, where they enforced social distancing to the max, they closed schools, colleges, and all non-essential services. People were not allowed to go out beyond 2 kilometers of their houses, even for say exercise and running, for example. And so those kind of strict lockdown conditions were imposed for about a month. And the government then established and then escalated or increased their capacity for contact tracing and nationwide testing of people. Of course, anybody who had the hint or suggestion of possibly a disease or a contact could then go and get themselves tested. Besides, anyone who were entering the country at that point were asked to be quarantined for 14 days. And that was kind of the plan that was the plan that the country went with. And lo and behold, what happened thereafter was that as the number of or the capacity for contact tracing also was ramped up, so the government increased their capacity of contact tracing. But then again, they formulated a committee to investigate as to what was happening. But the other thing that the government did very well was that they were very transparent about the numbers of the cases that were put up on public domain. The Prime Minister of the country, along with the Director General of Health Services, would appear before the press every afternoon at around 1 p.m. local time and explain the number of cases, the number of people in hospital, etc., etc. So that kind of helped people to get a sense of the gravity of the situation. People also, by and large, complied with the government's policies. And, it was kind of a team effort that within 1 month, we found that the effective reproduction number by which a country can kind of assess the spread of the infection kind of came down. And at that point, government stepped down from level 4 to level 3. And then in another month, we went down from level 3 to level 4. And then now we are in level 1 starting starting end of May.
Yeah, I think the Prime Minister of obviously your country, Jacinda Ardern, I think, and maybe I've booked the pronunciation. It seems to be a common thing with me and names from people of other countries. But her response, I think she's won a lot of credit as well during this. Like, just wee silly things. I think there was an interview I seen. There was like an earthquake halfway through her interview, and like she just continues with it because obviously it's so vital that she is putting out that information to the public. I think she's obviously carried herself quite well during this.
Yes, she has definitely given a very strong leadership, because what New Zealand did was that they took the public health approach, a very strong public health approach. As you know, there is no vaccine anywhere near. We don't really have a reliable set of medicines. So given our capacity, the Prime Minister, of course, was leading from the front. And so she was quite, she was both, she was very strategic. She was very kind. And at the same time, she was very strict about certain rules and regulations that people should be following. But also, what was remarkable about Jacinda Ardern's approach was that that she was also giving space to almost everyone. So in other words, if the government was framing a policy, then any citizen was allowed to criticize it and write to the government, and then many of them were then invited to come and comment. Even the opposition leaders were put in charge of parliamentary select committee to look into the operations of that. So you see, it was kind of a teamwork, but she was clearly the lead of the team.
Yeah, we had something similar in Scotland, James, I think, didn't we? Do you mind the sort of about 6 weeks ago, they had the thing on the Scottish Government website where you were able to list your ideas and stuff?
Yeah, I remember that. I mean, there seems to be a real contrast looking at how the UK and Scotland have responded to how New Zealand responded. And looking also at the numbers of both cases and deaths, I think that's kind of borne out in that. What do you think has been the real biggest difference in how the two different countries have responded to the COVID pandemic?
I think if it's a little bit difficult to comment on the UK sitting so far away, not knowing the full things. But it seems to me, reading stuff on the web and on other documentations, it seems that New Zealand's response was quite well planned, coordinated, and tight, and they were kind of consistent right from the beginning. So if they said that, okay, we are going to shut down the country, then they would say that, okay, we are going to shut down the country for X days, and these are the reasons why we are doing this. So there was no vacillation. In other words, okay, but we realize that this is a problem, and then we're going to address it and attack it like that. And I think that was one of the biggest difference, as far as I understand it, between New Zealand and many other countries, not just including the UK. But as you said, that in Scotland, of course, you are having something similar. And it seems now, after all these months of the epidemic, that if a government of a country takes some very decisive and public health oriented actions right from the beginning without losing time, that seems to stem the rot. So New Zealand did that, South Korea did something similar, Taiwan did something similar. And in each of these situations, you can see that the speed at which the infection was growing kind of got stemmed, and then the rates of infection came down. So that's one of the factors that kind of seems to make a difference.
I think definitely over here, there was when countries like South Korea and yourself started locking down very early, and there perhaps wasn't many cases and there wasn't many deaths in particular. Nations like yourselves perhaps went, well, why are they doing that? Why the economic effects that could have and the different cons? Surely they should wait until it's absolutely necessary. But I think what's been proven now is that was needed, because even though the UK waited, I think it was one of the longest nations in waiting for a lockdown, we are now having to deal with the repercussions of it for a more prolonged period of time, because our infection rate got more out of hand than New Zealand's, who were able to basically put a lid on it from day one.
That is absolutely correct. Very, very, very well said, Ben. Actually, what has happened is this, that also remember that in case of UK, there was this, when you had that football match, I think, wasn't it? There was a big
a couple,
exactly, from all over Europe, and that was one of the seeds by which things got kind of out of hand to some extent. Now, this is important because yes, you will have to cop a fair bit of economic downturn if you shut down the country for an X period of time. And one of the things that I remember that the government has been harping on right from the day one is this, that if we now start with the highest lockdown and we want to keep it a little longer than what is expected so that we don't have to come back to it again. In other words, the government would not likely to be extending that strict lockdown period a second time or go back. If you are in level 3, then you're not going to go back to level 4. And that kind of helped the situation. That's sort of an idea. So even though there was like a 2-month lockdown period overall, now that we are out of the red, we are kind of free to conduct our business.
That's just such a distant reality for us here in Scotland, really, and across the UK. And I think, to be fair, even though I don't think the UK's response as a whole is shone a great light on the nation, I think there's a lot of nations that are like that, where just what you guys seem to have in New Zealand just now just seems so far away. It's almost like use a back, not fully. Obviously, you're still going to be wee things and bits and bobs that are in place, but it is a bit more like what we're used to in the normal world.
Yes, and I think again a good point. The point to watch now is just that the borders are now closed, so we don't know what's going to happen once the borders are open. But having said that, small country surrounded by the ocean, island nation, all of these things kind of help to start with. Also, we had very low caseloads, so we don't know what might have happened if we had massive caseload to start with. We were a connected country and things like that. But those are all speculations of what if. We just don't know the answers to that.
Looking at New Zealand, it's a kind of very well diversely spread country. Kind of some of the bigger nations have had issues where non-white groups have had a higher prevalence of the disease. Has that been something that's been repeated in New Zealand?
You mean the impact of the prevalence of the disease?
Yeah.
Yeah. See, I mean, I've been thinking about that for a while. But one of the things, if you try to understand, is this, that COVID-19 spreads in clusters. In other words, it's not like if you have COVID, everyone's going to get it, right? There are certain clusters where the epidemics emerge. For example, in New Zealand, we had 16 clusters. Not everyone in the country were affected. The same thing with large countries. Say, for example, the United States, right? They started with a cluster in Washington State. Then they had a massive, there are several clusters in New York State and New York City and things like that. They always happen in clusters. Now, if the government or if the health agencies or whoever that is can identify and move on to contain the clusters early enough, then regardless of the population load and the initial prevalence, there is a good opportunity that those can be kind of tackled in the first place. So that kind of where the hurdles are, and then you go and snap the transmission lines there. And that's the kind of thing that's quite useful. And this is where your lockdown and your social distancing measures become very, very useful. Practically speaking, good testing and good contact tracing are really as good as vaccines in a public health context.
That's interesting, because the way it's been, at least perhaps it's just the way I've read it, is I think a lot of the general public feel like it has to be a vaccine that destroys this, that I think you'll be living with it in some shape or form until that happens, but severe it will be, perhaps people about you.
Again, I mean, this is a very interesting disease, because it's not like Ebola, right? So what happens in Ebola is you get the infection, then you die quickly. So it doesn't get a chance to spread. Whereas this guy, it spreads slowly amongst everyone. And then the mortality is not that high. In other words, it kills, but it kills the elderly people, right? So your risk of dying from COVID-19 is not as high as your risk of getting COVID from someone else. And that's something that one needs to keep in mind. And this is the reason why a good and robust and a well-conducted disease surveillance system that can test people widely and can snap the transmission lines once they can identify the contact pattern and network is going to be very, very useful. You see, even if you don't have a vaccine, getting a vaccine is excellent. If you get a vaccine, then you vaccinate people, people get immune, story ends there. But if you don't have, what you do that.
It is quite odd how this is. I mean, who would have thought, I mean, a couple of months ago, like, the way we were talking in this country is that we were going to have to pretty much do this until, I mean, what were they saying, James, about like this time next year? that pretty much it would just be the way as it is, but at least now it seems like it's taken a while to come in to see the effects of it and how positive it can be, but it seems like physical distancing has helped in some regard.
Yeah. Yes, and remember that, okay, the story of vaccine can be quite complex, because remember this virus mutates. Right? It mutates every like 2 weeks. And so you develop a vaccine against strain X, but then you find that the strain that's circulating is like strain XA, right? So you're not quite prepared to, so okay, you get a vaccine, but whether the vaccine is really going to work is open to question again. So so that makes the issue of vaccine a little bit tricky. Yeah, and there are two things here. You get the disease, and then you treat it, and you try to prevent the disease in the first place to get spread. So there are two different approaches, two different things, and there's no really good answer in terms of what happens when you get the disease and what strategies you do in order to treat it effectively. Whereas there are some good answers in terms of the public health approach to say that, okay, what works so that at least the community spread can be contained or mitigated. And as a first answer is where it helps if you can focus your energy at the moment.
Yeah, I think a couple of the points I've got down is just to sort of move through them. Obviously, the death rate, obviously touched on it a wee bit. I think it stands at 22 in New Zealand, and you've not had any deaths in this for over 3 weeks, which is quite incredible, really. When there's still nations that are really struggling with this pandemic.
Thank you. Yes, that is true.
You've touched on a few of the nations already, but Scotland and New Zealand are quite similar in terms of population, and we're into 4 figures of deaths. So how has and we're both islands. So how is one get 22 and one's in 4 figures and a death toll?
Oh, it's an excellent question. Excellent question. And that has to be properly systematically investigated, certainly, to see what it is. But maybe I can tell you the New Zealand side of the story. Our death tolls were mostly because these were in people who were in the elderly households. We did not have any deaths of people below 60 years of age. And almost all the deaths were amongst individuals above 60 years. Most of the deaths occurred in what you call them? We call them aged residential care homes. So you call them old age homes? Or?
Yeah, care home. We just call them care homes.
We've actually had more deaths in care homes now than in hospitals in Scotland. So we've kind of had a similar problem with it affecting the elderly more than the wider population.
Yes, we had the same things, except that our deaths were lower for some reason. And the other reason was that we probably did not have any real community transmission in that bad sense. Almost all our cases were imported cases. Most of our people who got infected were kind of young people, so between 22 and 29. So 20 to 29 year age olds were the ones that were most affected. So because we really did not have too many elderly infected, that's how probably we averted the high death rates. But that may not be the case with Scotland, and that may be the reason why you have higher death rates than this. Because, as you know, COVID-19 is known to disproportionately cause death in the elderly as opposed to younger population. So, and also if you've got too many people who have got diabetes or hypertension, so those are the people who are more at risk of death. And we, of course, have got Samoans and other groups of people here who are at high risk of those kind of diseases like hypertension and diabetes. But the government moved in very quickly and isolated those communities and started testing and contact tracing those people. So the rates of infection in those communities were far lower in the Pacific community. So that was kind of that helped New Zealand to keep down the rates of the death rates.
Yeah, I think another obvious an unseen problem really is obviously asymptomatic people as well, and I think it's been a particular problem in Scotland. Not so much people are infected, but it's almost like trying to educate people that you can be infected with this virus. You might not feel anything at all, but you do have it and you can give it. And then it's all about the R rate then, isn't it? I think if it's
Yes.
is it one, if you're infected, you give it to 3 others and it goes on like that?
One of the things that really helps if you can educate people, or if you can convince people to behave in public as if they are infected. So rather than believing the other person infected, pretend as if you are infected, and what can you do to not pass the infection to other people. So the best things are, for example, hand hygiene, respiratory hygiene, wearing a mask when you are out and about, that kind of stuff. And as far as possible, stay home, stay indoors, so that you are not going to pass your infection to the others. So that kind of that was also a message that got circulated in the days when we had level 4 or people who were at risk of getting infected.
Just with your levels, obviously we're doing a similar thing here where I think it's phase, it's called here. So I think we're in phase.
I see.
I think we're in phase 3, but that's meant to happen over many months. You seem to have moved through your phases or levels extremely quickly to a point where you're almost normality. How have you been able to do that? So to turn it around from a pandemic situation to being able to go back to normal life within what seems to be 6 to 8 weeks?
Yes, I think you're absolutely on the money there, and it is something that is very interesting, in particular in case of New Zealand, that we were able to contain it within a short span of time. We moved from level 4 to level 1, and who knows what's the correct explanation? But it seems that the government kind of ramped up their testing and contact tracing capacities to some of the world's highest at that point. And they were very meticulous about it, and people kind of complied. So, and I think in general, because of that rapid ramping up of the testing contact tracing, and because people by and large kind of agreed to stay indoors and comply with the government regulations, those two things kind of helped. And also, as you know, we really did not have a great load of infection to start with. And most of our infections were amongst the younger population who recovered quickly. And so that was the reason why I think these factors kind of helped us to move quickly through the levels. That may not be the case somewhere else. Quite special, to be honest.
I mean, looking at some other places, Florida, I believe, reported a huge spike in cases today or yesterday after clearly they've kind of reopened everything far too early. Why do you think New Zealand's avoided a similar problem?
Yeah, that's because when they decided to, when they took the decision to open up the country, remember that even when we were in lockdown phase 2, we had several days of the run where we did not really have cases. Yeah, so we did not have new cases for like days on, and then one case would spring up. And so each one of those days, the government decided to delay opening up the economy farther, right? And the idea was this, that we would be ideally opening up the economy if we had 28 days run of 0 cases, but that never happened. What happened instead was like about 17 days or 15 days we had 0 cases, at which point the government decided to open it up. Now, this run of 0 cases tells you a story. And a story is this, that there is probably very little chance of either new cases or any case at all in the community. So there were some islands when the South Island became case-free or disease-free. So there was still some cases in North Island that they decided to wait and watch. And then when they became kind of as low as possible, then they opened up the economy. So at the moment, with the borders closed, we don't really have cases that can spring up. But having said that, there is no guarantee that no clusters are going to come up. They can come up anytime because it takes one person to start a cluster, you see. So it could be a stroke of luck. It could be a stroke of, it could be something that there is really no case in New Zealand that can lead to the emergence of these new clusters. At the moment, we just don't know. And then there is a question about asymptomatic cases, as Ben was referring to, and we just don't know what's going on there. But having said that, if you know that somebody might be exposed to, and then something like 20 days passed, then you know pretty much without any manifestation that there was no infection. So how that's going to work out, who knows? But at the moment, we are doing okay.
It seems so simple that an island, obviously not on the mainland, gets to shut their borders, and it's much easier for a country like ourselves and you to shut the borders, not let them in. And
yes,
days it's easier than on the mainland. But Britain, for some reason, hasn't done that. And I think even there's a case of how effective it is, because it's not only just New Zealand. I think there's an English island called Guernsey as well. I think their schools are opening back up and they're sort of getting back to normal life, because they've been pretty much just stopped anybody who wasn't an islander or a native getting onto the island. It just seemed like the shutting of borders was an effective method as well, but obviously it's still not happened in the UK and other islands around the world.
Yeah, it is difficult to manage that kind of things for, democratic and open countries where, people can move between the borders and boundaries. And it's very, very difficult to control everything like that. Whereas if you're landlocked, if you're sea locked or ocean locked, then it makes it a little bit easier for the countries to say that, look, the borders are entirely closed, because you can close the air border anyway. And if there's a natural geographic boundary, then that helps. Mm-hmm.
Yeah, I think obviously I can imagine like nations like Spain, for example, would.
Yes.
I mean, how would you? Because you've got 3 or 4 different borders there. I mean, it would be borderline impossible to stop at least somebody getting in across your border.
Exactly.
As well as you've got the implications of people still trying to come into the country that are from there. It's not just as easy as clicking a finger, but the country has shown it definitely does help if implemented correctly.
Yes, exactly. You just exactly nailed it. That does happen. Mm.
Yeah, I think obviously looking over at New Zealand this week, we're all a bit jealous. We're all obviously big football fans over here, and seeing the pictures of at the rugby and things like that of fans back in the stadiums, which is we're talking about being back to normal life, is a bit surreal. That looks like something out of a fantasy film now for us. How have you been able to get to that point as well, like being able to mass gather in thousands in this case, all in the one place?
Yes, this is a very interesting, very important question, because we had a massive rugby match yesterday, and we had a 40,000 stadium that was filled after many, many years. They had that. And I think it's quite interesting what the organizers were doing at that point was that the government introduced an app, and that app was had a QR code camera and QR code in it. So what they were doing was that in every stadium, every seat, they had pasted the QR code. So before you could take the seat, you were going to go and snap that QR code on your camera, and that kind of sent information out as to who was where in what case. Again, you can see that those strands of electronic contact tracing in place. Yeah, although there were no restrictions now in terms of how far people should be apart. But some establishments are still maintaining it. For example, I visited a barber shop on Saturday, and I saw that they had 1 meter distance between the chairs that they had placed there. So, kind of horses for courses. And here we see that but we did not see that no other restrictions were placed on people entering the stadium or some things like that. So it's quite important.
That's just crazy to us, you know what I mean? I mean, I might need to try and get over those borders in New Zealand for a haircut, to be honest. I mean, it's getting out of control here. But it's just, I think it's great to see. Obviously, we're looking on a bit jealous over here, but it must be a great feeling for you guys that you're pretty much, you're perhaps looking at the finishing line, you're just about to cross it.
Yes, well, just about. We don't know the long-term story, to be honest. We can feel a little bit happy that, okay, we have tamed the beast, but we at the same time, we feel for all of you. We feel that, unless all of us are safe, none of us is safe, to be honest. So yes, while there is a sense of, okay, we are okay for the time being, we are definitely concerned about all of the other countries in the world where people are struggling. So if we can do anything that can help other people, other countries, we're all for it.
Just on mass gatherings as well, obviously you guys are okay, but in the UK it's still obviously advised that you don't gather in mass numbers. And from obviously I'm a bit younger, and perhaps it's just my demographic of people that I've got on my social media, but I'm seeing lots and lots of people out in 20s and 30s, big house parties, garden parties. Just how dangerous is that when the R rate is just below 1?
Yes, and I think that's something that many people miss, because remember that when we opened up here, they said that they were not going to open the pubs till about 1 week into the opening of the other businesses, and the pub owners were not happy about it, but then they seemed to realize that was the case. If that was the case, then that was it. And they also kind of started allowing mass gatherings in numbers. So they stated first that, oh, you're not going to have more than 10 people. People didn't like it. Then I said, all right, you're going to have about 100 people till about level 2. And then they said that, okay, you're going to have more than 100 people. And now it's virtually unlimited. So staged opening sometimes is useful, as long as people follow that. But again, people will be people. They will not always follow all the instructions. I'll still be big parties and everything else. So those are the ones that you have to keep an eye out and see that, no new clusters can emerge out of this, because that's exactly happened here. When people had gatherings and wedding parties, that's where you started having new clusters coming out.
Yeah, I don't know about you, James, but it almost feels like, I think I spoke about this on our podcast, is that COVID-19 just feels like something on the telly now, obviously, because we've not, Scotland, obviously, every death is trying. We still have had quite a high number of deaths, but perhaps not everybody knows somebody that's been affected by COVID in that way. And it just feels like many that it's just that thing on the telly, this rampaging virus. It's not going to affect me, though. I'm not over 60. People flouting the restrictions and their numbers, it seems.
Yeah, no, I think that's another very, 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 very important point, and that's something that has happened all over the world, even here as well. So obviously, people seem that they're invincible, and that's something that you have to be very careful about. It's something that spares no one, but maybe you'll suffer less or suffer more, but that's a different story. There's no guarantee that no one is going to be affected. Everyone is potentially affected. So that's why sometimes it helps to turn the story around and say that, look, as long as there are restrictions in place, pretend that as if you are the person who's going to pass it on. You may or may not, but something like that to get people at least up and moving. That's what our experience tells us.
Can I just ask as well, how closely have you followed sort of the stuff in the UK, or has your work in New Zealand sort of consumed you over these last few months? I can predict you've probably been a bit busy.
That is true. That is true. Well, so what was the question actually about?
Yeah, how have you followed much of what's been happening in the UK or sort of countries around the world just with this?
Yes. Well, as much as we could using popular media. So we've been following the UK, and of course, as you know, New Zealand has very close ties with the United Kingdom. The Isles. So we've been keenly following what was going on but the access to information was limited only as far as we could get through the TV and through internet. And of course, that we had one of our nurses who went and was on the care team of Boris Johnson. That was kind of given a lot of publicity here in this country.
Yeah, I can imagine, yeah. I mean, what kind of big lessons have been learned from this? Obviously, these kind of things happen once every 100 years if we're lucky, or unlucky maybe. What's the real big lessons that we can learn from it?
Wow, that's an excellent question. So, what lessons? And as you know, I mean, every pandemic changed the world in many different ways. And when the original influenza pandemic came on, there were several. The whole the science of public health kind of got changed and emerged from what was like not so prominent. This time, you expect to see that a lot more emphasis on personal protections and use of technology as delivering tools. That will become quite commonplace. As you can already see that, the whole thing about how technology can be enabler, like we are talking here right now. I'm in New Zealand, you're in Scotland, and we can having a conversation as if we are sitting across our rooms. And that itself is one of the best outcomes that I've seen. When before this, just compare the number of Zoom meetings people had before 2020 and after 2020, and you'll see that during the period there is a record of that increase. So that's another thing that can. So how do we conduct business across media like this? Or perhaps once we get out of this morass, there will be more emphasis on go local, support each other, local businesses, and see how you bring up the economy in that sense. Something like that. We don't know. But it's an excellent question, James. I mean, it's not a question that we can answer in a bit.
He gets deep into thought at this time of night, don't you, James?
That's it, yeah, aye.
I don't mean to be like, obviously it would be nice if we went and we bought local and we didn't go to our big chains, but my feeling is that a lot of people say, oh, we've learned these lessons, we'll do this, we'll do that, and then it'll be a couple months after the lockdown. I mean, you've even seen it in this country. McDonald's opened and you would have thought that they've not eaten 2 months. There's mile-long queues to get a Big Mac. It's like, how... I just hope that we actually learned the lesson, because there's been signs already that people are just like, that's done, back to normal.
Great point, Ben. I mean, a few days back, I visited a mall, and the mall was like chock-a-block, and they said that almost like visiting a mall before Christmas. There were so many people around, knowing fully well that even at this stage, overcrowding can lead to emergence of new clusters and things like that. So yes, people, you expect people will learn something, but whether, to what extent, how, these are big questions, open questions. Some people will, of course.
Yeah, I think as well, just in terms of, obviously we're not scientists or medical professions by any stretch of the imagination, but I'd like to think your field as well probably changes quite dramatically off the back of this.
Yes. And it already has. For example, to give you a concrete example, before this, if people were to publish in non-peer-reviewed journals and things like that, they'd be frowned upon. Yet now, there's so many citizen scientists, crowd scientists, ordinary people have come up with their own homegrown, home lab-grown analysis and things like that. They've put it up. And, people have been working on from those insights and things like that. So a tremendous amount of online-based insights and knowledge that has come up through this. It's quite incredible what is going on at the moment. I mean, 1 year, 6 months has made an enormous impact on many of the scientific practices and the ways we think about the world. I mean, I don't know. I mean, it's mind-blowing.
Yeah, I mean, it's even weird that they talk about vaccines and they're saying, oh, it's going to be next. Like, I know some people have said it's going to be next year, especially sort of our leaders across the UK, but it's like, are we living in like fairyland when it comes to, like, it just seems so odd. Like, science seems to have come on so much in such a short space of time with this, and they're speaking about having vaccines within a year, and it would be an incredible scientific achievement and things. I mean, it is
absolutely. Absolutely, absolutely. I mean, yes. I mean, it's a remarkable feat if they can make it, and if that can be done. That itself is a triumph to get a vaccine as close as and tested and done, and crowdsourcing of randomized trials and things like that. So it's just out of the world. Mm.
Yeah, well, almost done. Thanks very much for your time. I know obviously
Right.
you'll be kept busy with this. What are your sort of hopes now for New Zealand? Just going forward, obviously spoke a wee bit about that. Perhaps you've tamed the beast a bit, but sort of perhaps in 3 months' time, where do you hope that the country will be?
Good question. We don't know as yet what will happen once. There are two things. We don't know what will happen once the borders are open, or we don't know what will happen once we start repatriating people who are already overseas and then coming back with infections. At the moment, we have done like they are they're kept in quarantine for 14 days, and many people go out. So that will be something to keep an eye out to see what happens or whether any new clusters emerge out of that. Two things: if the borders remain closed and new clusters emerge, and that's one thing. And if the borders are opened and new clusters emerge, that's another story. So there may be new strains and new things coming out. So it's still quite open.
I suppose perhaps interesting isn't the right word, but it's going to be at least intriguing for you guys as the scientists and epidemiologists that once these borders do open, and if you say you maybe get 3 or 4 crawl up here when there hasn't been any in weeks, that's then going to be your new challenge.
Yes, absolutely. And I think that's the reason why we have to keep an eye very, very carefully on the rest of the world in terms of what happens, because as you know, New Zealand depends a lot on overseas workers to come here and work. And particularly, in plantations, in orchards and somewhere else where we need overseas workers in building industries and stuff like that. So, those countries with which we have got close ties, say for example, the Filipino workers who come and work here, and workers from Asia, somewhere else. So we have to be very careful when we start opening the borders and we start testing people. And how do we do that? What are the parameters? Have to be very, very carefully thought. And as you say, that once the borders are open, if new clusters emerge, then it's a new challenge.
Yeah, I mean, you're going to, I think, I don't mean to put a dampener on it again, but I mean, I think we're going to be waiting a wee bit for the world to heal from this. I mean, it just seems everything that could go wrong in the world right now just seems to be going wrong. It just seems to be a collective, it's one thing after another. But
it is true.
But hopefully get back to sort of a fair and equal society, and hopefully COVID-free as well in coming weeks and months. But Arindam, thanks very much for your time. Really appreciate it. Banks and Black on Twitter, Banks and Black on YouTube. Subscribe to us on YouTube, iTunes, and Podbean. Till next time, take it easy.